Hello, everyone. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester. Let me quickly introduce myself to those who may be new to Navigator Nuggets. I am a board-certified pediatrician, a former caregiver to my dad, and the CEO of Your GPS Doc, LLC. And I help patients and their family caregivers navigate the complicated, confusing, crazy healthcare system. And one of the ways that I do that is through this weekly Facebook Live show, Navigator Nuggets. Okay, so you can check us out here every Monday night at 8 p.m. Eastern Standard Time, right here on the Your GPS Doc Facebook page. So if you have been following me, you know that for the entire month of February, we have been talking all about health insurance. If you missed any of the previous episodes, we talked about surprise medical bills and in-network versus out-of-network coverage. We talked about pre-authorizations, and we talked about appeals and how to appeal when your insurance company says no. So on this last episode in February, I wanted to talk with you all about a few tips that you need to know when choosing health insurance, okay? Because I have seen so many instances when people have chosen the wrong health insurance plan for them and for their family, okay? So thank you to all of you who are watching live. Thanks to those of you who are catching this on the replay. Be sure to like and share this video with people who you know will benefit from this information, all right? So let's go ahead and get started. Okay, so many of you probably have health insurance through your employer, through your job. And some of you like me may have to purchase your health insurance on the marketplace or through the Affordable Care Act. And the bottom line is that whether you get your health insurance through your job or whether you are actively buying your own health insurance plan, it is important that you understand some basic terminology when it comes to health insurance and that you know what to look for so that you are making sure that you get the plan that's right for you. Okay? So I'm just going to go over a few basic terms. The first thing I want to talk to you about is HMO versus PPO. Okay? HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. And most of you with employer-based health insurance, you may have the option between an HMO and a PPO. And certainly on the marketplace through the ACA, those are generally the two options. So how do you know if an HMO is the better option for you and your family or whether you should go with a PPO? What I don't want you to do, and I've shared this with you in previous episodes, is to just look at the price tag. And I'm putting price tag in quotes on purpose because many of you focus solely on the premium, that monthly amount that you pay every month for your health insurance. And you don't even know all of the hidden costs and all of the other things that are involved, okay? So you cannot just focus on how much money they're taking out of your paycheck every 2 weeks or how much money you're sending to that company through their Affordable Care Act plan every month because it's so much bigger than that. So HMOs generally are going to be cheaper in terms of the premium. They are usually going to have the lowest premium, but I just want to make sure you understand what the trade-offs are, okay, so that you know whether that's the best plan for you. Now, an HMO is always going to have a network, and we talked about networks back in the first episode of this month. So go to the videos tab and scroll through if you missed that. But essentially, that is a group of doctors, laboratory facilities, x-ray facilities, and hospitals that are contracted through your health insurance plan, okay? And so with an HMO, you generally have to get your care through that network of doctors. In some cases, if you go outside of that network, none of the care will be covered. I mean, zero. Like you will get the whole bill. And in other cases, you may have an HMO where they cover a percentage of the bill if you receive care out of network. But as a general rule, you must stay within your network in order for the care to be covered. Okay, so that's one of the reasons why the premiums are lower, because they control costs by keeping you within a network. And that in and of itself is not bad. Okay, but why it may not be for you is that if you or another member of your family member who is covered on that policy has chronic conditions or something serious like cancer, and you already have an established group of providers, maybe you're seeing the world's best expert in multiple sclerosis, or maybe you have a neurologist or an endocrinologist that you or your loved one has been seeing for years. If you get an HMO plan, you may not be able to see that doctor. You need to be very careful before you sign up and make sure that the doctors that you are already seeing, if it's important to you to continue seeing them, that they are indeed included in this network, okay? Because I have seen it time and time again where people sign up, they don't read the fine print, they don't look at any of the documentation, and then they try to go for a follow-up appointment with one of their specialists who's been seeing them for 10 years, only to find out that that person is not even in the network for their new insurance. And so they're either going to have to pay hundreds of dollars, maybe even more out of pocket, or see somebody new, okay? So that's what you need to know. The other thing with HMOs is that, with same thing with the formulary, which is the prescription medications that are approved. And that's also kind of a network. I don't want to get too technical, but every health insurance plan has a formulary, but sometimes the HMOs will have a more tight formulary, so to speak, meaning there may be a lot of drugs that are not covered, particularly specialty medications and things like that. So again, if you're going to choose an HMO and you're already on medications that you've been taking chronically, you want to make sure that your HMO plan is going to cover those prescriptions. You do not want to get in a situation where the prescriptions that you've been taking for years, now you have to pay out of pocket. And some of those prescriptions can be literally hundreds to $1,000 plus per month. Okay. So you need to be very aware. That's all. I'm not saying HMOs are bad. I've had HMOs, but you just need to know what you're getting. Now, in contrast, a PPO or a preferred provider organization generally gives you a little more flexibility. Going back to HMO, let me just finish this thought. I'm sorry. With an HMO, you usually will need a referral, and it depends, not all of them, but as a general rule, you will need a referral from your primary care doctor in order to see a specialist. Some people don't care about that. Hey, no skin off my back. Some people get annoyed by that. So you're telling me, doc, that I have to make an appointment with you. I already know I need to see this neurologist, but I need to make an appointment with you first, only for you to say, yep, you need to see a neurologist, and then give me a referral. Yes, because the primary care doctor in an HMO plan is literally the gatekeeper, okay, to a large extent. Now, let's go back to the PPO. So with the PPO, you generally will have more flexibility, but in exchange for that flexibility, you will have a higher premium, meaning you will pay a little bit more for those plans. Now, what do I mean when I say you have more flexibility? You generally do not need a referral. In fact, in many cases, you don't even need to choose a primary care doctor. And I'm certainly not saying that everyone should not have a primary care doctor, because I believe that you should. But under a PPO, you often don't need to choose a primary care doctor. And you can basically go see whoever you want at will, but there is usually still a network, okay? Often the networks for PPOs will be broader. Some PPOs will even allow you to see doctors in other states. HMOs, that almost never happens. So you usually will have a wider variety of choices for the doctors, okay? And similarly, the formulary, the prescription medications that are covered may also be larger. There may be more medications that are covered. But even with the PPO, you need to make sure that you understand what is your coverage for out-of-network providers. We talked about this on a previous episode. So you need to know, do I even have coverage for out-of-network, which usually you will. Standard scenario may be, as an example, maybe in-network for a specialty visit, maybe you pay 20% of the bill. And if you go out of network, maybe you pay 40% of the bill. So there is somewhat of a penalty, so to speak, but you still would be allowed to potentially see that renowned specialist or that doctor that you've been seeing all your life, but just at a higher copay or coinsurance. Okay. So that's the HMO versus PPO. The other thing you need to pay attention to when you are choosing your own health insurance is the deductible. Let me take a deep breath. So the deductible can literally be something that makes or breaks you. That is the amount of money that you have to spend out of your pocket before your health insurance benefits kick in. Okay. Now, most employers are moving toward these high deductible plans because, again, they're trying to shift the cost onto you, the consumer, you, the patient. Okay. And so what happens is these plans may have premiums that look really attractive, but you have to spend $2,000, $3,000, $5,000 out of your own pocket before your health insurance benefits even kick in. Of note, basic preventive care like once annual physical, mammogram, screening, colonoscopy, those things are included prior to meeting your deductible, okay? And because of the ACA, those things are generally going to be free. But you may have to pay completely out of pocket for the visit to an emergency room, to an urgent care center, and even a primary care visit for an illness before your health insurance benefits kick in. So people unknowingly get these plans, and then they wonder, why they're getting, bills for $450 for a doctor visit or $250 for laboratory studies. So, this may be helpful. High deductible plans are really good for healthy individuals. If you don't have any chronic illnesses, you don't take any medications on a regular basis, and you have a little chunk of change socked away in a bank account or something, something where you can get your hands on it easily, then a high deductible plan may be the best thing for you. But if you or one of your family members has chronic illnesses, takes prescription medications regularly, is a relatively high user of medical care, then getting a high deductible plan can be devastating because you will quickly, just be paying out of pocket every single time that you or your family member is getting medical care. Okay. So those are the main things that I want you to know. Be very aware of HMOs versus PPOs. Be very aware of that deductible. These are the things that when I meet with clients, when I talk to friends and family members, they get burned because they don't read the print. They don't read through the document. They don't really understand what they are getting. Okay. And the results can be disastrous. Okay. So that's it. Listen, I have a course for those of you who may be self-employed and who purchase your own health insurance. I have a course called Healthcare for Bosses. It's going to be relaunched very soon. So if you are interested in getting on the waiting list so that you are the first to hear about that course, I encourage you to go to bit.ly/GPS course 1. Okay, that's bit.ly/GPS course 1. In this course, we take you through everything you need to know about health insurance so that when you are purchasing your own plan, it is easy breezy. Okay. And I have testimonials from the individuals who took the course. I'll be posting that soon. They loved it. We had a great time and they all learned a lot. Okay. So that's for people who have to purchase your own health insurance. Otherwise, if you, feel like you need one-on-one assistance, if you're having difficulty understanding your health insurance policy, if you are a caregiver, Medicare is a nightmare, or it can be, in terms of understanding it. So if you need assistance with that, I am always available to work with you one-on-one and to book a complimentary consult call so that I can learn more about you and you can learn more about me and how I can help. You can go to calendly.com/yourgpsdoc, and I'll put those links in the comments. All right, guys, so that wraps it up for tonight's episode of Navigator Nuggets. If you have any questions about anything that was covered today, feel free to drop those in the comments. I always come back and acknowledge your questions and your comments. Thank you again for tuning in. Don't forget to like and share this video, and I look forward to seeing you next week. That'll be our March series. I'm really excited. I'm not going to tell you yet what we're covering in March, but every month is going to have a theme. So we will be shifting gears and talking about a new topic on our next episode. So I'll see you next Monday at 8:00 p.m. Eastern Standard Time, right here on the Your GPS Doc Facebook page. Take care.